We are back. Well, in her brand new book, Brooke Shields is Not Allowed to Get Old, the star describes how a doctor gave her what's known as the husband stitch without her consent during a labia rejuvenation procedure.
Our next guest says that this can also happen after a woman gives birth. So she's here to tell us more. And a warning, this might be difficult to hear about if this is something you've experienced. Please welcome back to the show, Dr. Sheila Wijayasinghe. Nice to see you, as always.
All right, so let's start with the basics in case someone hasn't heard. What is a husband stitch? What is it?
So a husband stitch is a procedure that is not medically warranted because it's potentially harmful, where an extra stitch is inserted into the vagina or the perineum to tighten the vagina, not for a medical reason, but for the partner's pleasure. It has nothing to do with medical. No medical institution agrees with this issue, this procedure. There's no actual formal medical term for it because it is considered medically unethical to do this. When people do get, in childbirth, you can tear, and we do need to repair it, but we're taught very carefully to repair it to approximate the tissues and allow for proper healing and comfort. The husband stitch has nothing to do with that. It is a violation of somebody's autonomy, and in this situation where Brooke Shields did not give her consent, it's actually medical assault, and it's absolutely very upsetting that we have to talk about this, but it does happen.
Wow.
And what was interesting is that when she started talking about it, it was that how many women were coming forward and talking about how this happened to them as well. So before we get into some of that, like, where did this procedure start from? And let me just guess, like a bunch of dude doctors at some point, right?
Yeah, I mean, it's really based in the patriarchy and sort of the devaluation of women's bodies. And where it dates back to is in the late 1800s is the first documented case where a physician did this to a patient. It was documented. But we know that through the 1900s that when episiotomies were brought into favor, which are not in favor anymore.
Episiotomies, yeah.
That is when we actually cut during labor to help the process of delivery. It was thought to be helpful, but it's actually harmful. So we just allow it to happen naturally now because we know that's actually safer for women. But that was then, we stitched more as a result. It's also really in the literature. The husband stitch is a term that's used as a metaphor for society's control over women's bodies. And really in medicine, our spaces should be safe. It shouldn't be a space where this happens, but it does.
Okay, so we hear about this from Brooke Shields, but like how common is this?
So we don't have formal data on how common this is. It's really based on anecdotes. So when patients share their stories, because it's not documented, again, this is not a medical procedure that is validated. And so we don't have numbers on it. I remember when I started practicing, I did deliveries. And I remember one patient's partner asking me, hey doc, can you like throw an extra stitch in? And I remember feeling, and I still feel it now actually, the anger and the hurt that I felt for that patient, that even if it was done in a jokeful manner, it was really awful that this was even brought up. And my colleagues are all appalled that this is happening, but it does happen. We see this happen, but it's not super common necessarily, but we know it does happen from these stories.
Okay, I mean, I think I know the answer to this question, but is it ever warranted?
Absolutely not. So this is not a medically warranted situation. It is not a procedure that is warranted. It should never happen. The thought of why it was supposedly meant to happen is that after delivery, people said, well, the vagina changes and it doesn't go back to its normal state. It does go back to its normal state. The vagina is a miracle. It goes back to its original state. It returns to its size. It doesn't change pleasure in that way. There's no reason for this to happen, and it absolutely should not happen.
Misogyny.
Okay, so what are some of the risks associated with this procedure?
Right, so this is really important to go through because when we are taught to do this carefully, and I remember learning very carefully that we put only the stitches that you need to put in because it can cause harm if you put too many in, and it can cause chronic pain in the vagina or perineum area. The perineum, to be clear, is the area between the vagina and the anus. I didn't mention that at the beginning. You can have painful intercourse as a result. There's a higher risk of tearing for future pregnancies, potentially, and during that delivery. There's an increased risk of infection because the more stitches that you put in has a higher risk of infection as well. And then we can't underplay the emotional trauma that women experience if they find out that this happened, and people lose trust with that medical system and their healthcare providers as a result.
And Brooke Shields has said that she still experiences painful sex to this day as a result.
Yeah.
Oh, man.
Yeah.
Okay, so you really want women to know you have a say in the operating room or the medical room. So can you talk about that a little bit?
Yeah, this all comes down to consent and proper consent. And when we talk about this currently today, we're talking about childbirth and repair. But when I talk about consent with my learners and my residents, I'm like, this isn't in any procedure that we do. Pap tests, IUDs, endometrial biopsies, any procedure that we do for a patient requires proper consent, getting an ultrasound done. And consent involves three things. It has to be explicit or very clear, it has to be voluntary, and it has to be very understood by the patient. It has to be informative for the patient. And if those three things are not there, it is not proper consent. And all of our medical associations require this when we are doing any procedure.
So how can a patient ensure that this is not going to happen without their consent? Like, so a lot of times they're out of it.
Yeah, absolutely. And I think this is where preparation and talking about it, and I think because this story has come out and we're discussing it, patients are going to be talking about it more, and doctors and nurse practitioners and midwives will understand this. So really have that conversation ahead of time, discuss what your birth and repair preferences are. A lot of people will say, I don't want to have an episiotomy. That's very fair. That's important to state that clearly. Emphasize that the repair should be just for comfort, not for aesthetics. It's for comfort and healing, not for aesthetics. Always ask questions. If something doesn't feel right to you, ask questions. You can decline certain things. Certainly in emergency situations, you may not have always this opportunity. And always bring somebody you trust. It's a very vulnerable position to be in when you're delivering a baby, and you can have somebody that you trust that knows what your wishes are as well.
Mm-hmm. So listen, if someone is concerned about the impact that birthing a baby will actually have on their bodies, are there things that can be done pre-delivery to minimize any of these issues post-delivery?
Yeah, that's a great question. You know, pre-delivery, we talk about, I always emphasize to my patients, see a pelvic floor physio if you can. They can do prenatal visits and help you learn about your pelvic floor, and they can help you with something called perineal massage. They can teach you those techniques. There's not a lot of robust data that necessarily helps decrease tears, but it doesn't hurt to do it. So in delivery, you know, I know at my hospital that we work at, olive oil is used to massage the perineum to help with stretching a little bit, so that can be helpful. Postpartum, you want to do all the care activities just because it can be uncomfortable for any situation, so icing, anti-inflammatories, and then down the road, a gradual return to intimacy, lots of lubrication, and pelvic floor physio postpartum as well.
So we want to ensure this message gets across. So to summarize, what should women know about their rights and advocacy?
So I'm so glad that we're talking about this, especially in our political climate right now. You know, we have to emphasize women's rights, patient rights. The husband stitch is not inappropriate. It is unethical and illegal to do that, especially without consent. Informed consent is important in any medical procedure that you do. It must be explicit, informed, and involuntary. Bodily autonomy is non-negotiable. This is a lesson that we all need to know. My body, my choice. We are not allowing other people to make decisions for us. And it's really important to advocate for yourself. And I think together, you know, we talk about this because these are stories that we don't often hear, but the more, if this is something that you've experienced trauma in the medical system, we need to talk about it. We need to speak up collectively, because then we are powerful as a group. We work together to secure our safety, our loved ones' safety, and our future generations.
Such important information, Dr. Sheila, thank you. Really fascinating, really fascinating. Okay, we're gonna digest that. We're gonna take a quick break. We'll be back after this.
Hey you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.